Top 9 Danger Signs of Diabetes. You must know. Could you be overlooking the warning signs of diabetes? These early signals can silently impact your health, and if you don't catch them in time, the consequences could be severe. Stay with us to discover the top 9 danger signs of diabetes and how recognizing them early can make all the difference. Living with diabetes means making smart choices every day, especially when it comes to food. Eating the right foods can help keep your blood sugar in check, boost your energy, and prevent complications. But what happens when you ignore the signs your body is giving you? Today, we'll dive into the top 10 danger signs of diabetes that could be affecting your health. Recognizing these signs early can make all the difference in managing your diabetes and living a healthier life. 1. Increased thirst and urination. One of the earliest and most telling signs of diabetes is increased thirst and urination. It might sound straightforward, but the underlying process is more complex. As diabetes takes hold, your blood gets flooded with excess glucose, a type of sugar that your body just can't handle properly. You might not see it happening, but your kidneys are working overtime trying to filter this excess glucose out. It's like they're racing against the clock to clean up your bloodstream. However, in doing so, they pull fluids from your body, causing frequent urination. You take a sip of water, and moments later, you find yourself back in the bathroom. This cycle leaves you feeling unusually thirsty, a condition known as polydipsia. It's not just a passing thirst, it's relentless and persistent, urging you to drink more, which only continues the cycle of frequent urination, known as polyuria. This pattern emerges quietly, and many brush it off as simply drinking more water or the result of weather changes. But in reality, it might be your body's way of waving a red flag. According to experts from the American Diabetes Association, understanding and identifying these early signs can pave the way for early intervention and better management of the condition. Now, you might think increased thirst and urination sound like minor inconveniences, but they are significant indicators of your body struggling to maintain balance. Ignoring these symptoms can lead to more severe health concerns down the line, from kidney problems to irregular heartbeats caused by electrolyte imbalances. 2. Excessive fatigue. Have you been feeling more sluggish than usual lately? This isn't just about needing an extra cup of coffee. Excessive fatigue is another major red flag that your body might be trying to wave at you. For older adults, especially, this fatigue can be overwhelming, affecting daily life and overall well-being. So what's going on in your body? When your blood sugar levels are high, your body struggles to convert glucose into energy. It's like having a car with plenty of fuel, but the engine just won't start. Your cells are essentially starving for energy because the glucose, instead of being used, hangs around in your bloodstream. This results in that persistent, nagging sense of tiredness that doesn't seem to go away no matter how much rest you get. Additionally, a less obvious but equally impactful cause of this fatigue can be diabetes-related dehydration. As we talked about earlier, the frequent urination from excess glucose excretion leads to loss of fluids. When your body is dehydrated, it can't function at its best. Your organs and cells lack the necessary water content to operate efficiently, contributing further to fatigue. According to resources from the Mayo Clinic, such fatigue isn't just a sign of being overworked or needing more sleep, it's a significant indicator that your body's metabolism is off balance. The presence of high blood sugar levels consistently drains your energy, making it harder to perform even basic tasks. Ignoring it won't make it go away, and pushing through, as many tend to try, only exacerbates the issue. Understanding this symptom as a potential sign of diabetes could prompt timely medical consultation and testing, which is crucial for appropriate management of the disease. 3. Wounds that heal more slowly. For older adults, noticing that cuts or bruises take longer to heal might be more than just a part of aging. Slow healing is another crucial signal that diabetes may be impacting your health. When you're dealing with high blood glucose levels, your body's natural healing process is hindered. And here's why. High blood sugar affects circulation. When blood has too much sugar, it becomes thicker and moves more slowly, much like waiting in a traffic jam. This poor circulation means less blood flow to areas where healing is needed, like a skin cut or bruise. Without sufficient blood, those areas don't receive the oxygen and nutrients required to repair themselves quickly. But it doesn't stop there. Poor circulation can lead to decreased immunity, making it harder for your body to fight infections. So those pesky sores, particularly on the feet, that don't go away quickly, they could be signs to be wary of. This is not just an inconvenience, but a potential gateway for more serious infections. According to the American Diabetes Association, the effects of high blood sugar on the body's healing ability shouldn't be underestimated. For women, diabetes can also increase the frequency of bladder and vaginal yeast infections due to the high sugar environment that fosters bacterial and yeast growth. 4. Dizziness and/or fainting. Dizziness and fainting are more than just a passing inconvenience for older adults with diabetes. They can be alarming signals of low blood sugar, a condition known as hypoglycemia. Defined by a blood sugar level below 70 milligrams per deciliter, hypoglycemia can sneak up on you, causing a cascade of unsettling symptoms. Imagine you're going about your day, and suddenly you feel weak. Your head starts spinning and your hands even begin to shake. Confusion sets in, and before you know it, you might find yourself fainting. These aren't just random occurrences, they are your body's cry for help, signaling plummeting blood sugar levels. When you experience hypoglycemia, your body's cells are essentially starving for fuel, as there's not enough glucose in your blood to keep everything running smoothly. To others, these moments of dizziness might seem trivial, but for someone with diabetes, acting fast is crucial. Failing to address low blood sugar promptly can lead to more severe consequences like loss of consciousness or even seizures. Here's the good news. Hypoglycemia can be quickly remedied. Something as simple as sipping on fruit juice or consuming glucose tablets can elevate blood sugar back to safe levels. According to the Cleveland Clinic, always carrying a small carbohydrate snack can be a lifesaver when you're on the go. Before we continue the video, can I ask you a question? If you found these tips helpful, please hit subscribe so you can stay updated with more practical advice and insights for managing diabetes effectively every day. We really want to help you. 5. Headaches. Headaches are more than just a pain. They can be a vital warning sign of diabetes, especially in older adults. Our brains rely heavily on a steady supply of glucose to function properly. But when you're living with diabetes, your blood sugar levels can fluctuate like a roller coaster. These ups and downs can lead to persistent headaches, a symptom that often gets overlooked. When blood sugar levels spike, the brain is flooded with glucose. Conversely, when levels drop, the brain is deprived of its essential fuel. These extreme shifts can cause the blood vessels in your brain to constrict or expand, leading to that familiar throbbing pain. It's not just a random headache. It's your brain signaling that something's off balance. According to Harvard Medical School research, managing these headaches goes beyond popping a painkiller. They recommend a multifaceted approach, keeping a regular check on your blood sugar levels, maintaining a balanced diet, and staying hydrated. These simple changes can help alleviate the intensity and frequency of diabetes-related headaches. Ignoring frequent headaches can have more significant implications than temporary discomfort. Persistent headaches can affect your daily life, from concentration issues to disrupted sleep, leading to a cycle that's hard to break. Moreover, headaches can be indicative of other underlying diabetes-related complications, such as high blood pressure. Keeping a headache diary can be beneficial, helping you track patterns and identify potential triggers or lifestyle factors that may contribute to your discomfort. 6. Tingling sensations in hands and feet. Tingling sensations in your hands and feet are not just an annoying nuisance. They are a significant indicator that something more serious might be at play, especially if you or a loved one is living with diabetes. Known as peripheral neuropathy, this nerve damage affects roughly half of people with diabetes, particularly those who have had the condition for many years. Imagine waking up to pins and needles nagging at your hands or feet. Initially, it might be easy to dismiss these sensations as nothing to worry about, but over time, what starts as a slight tingling or numbness can evolve into weakness or even searing pain. This progression is your body's way of alerting you to the nerve damage that high blood sugar levels can cause over time. So, what's really happening here? High glucose levels can injure the walls of the tiny blood vessels that nourish your nerves, particularly in your extremities. This damage disrupts normal nerve function, leading to the symptoms you feel. According to the National Institutes of Health, nerve damage can be prevented or mitigated with proper blood sugar management. That means striving for a balanced diet, getting regular physical exercise, and maintaining a healthy weight, all of which can slow the progression of neuropathy and, in some cases, even improve it. If ignored, peripheral neuropathy can lead to more than just discomfort. It increases your risk of foot injuries, as the loss of sensation makes it harder to detect cuts, sores, or infections that can escalate without prompt care. This makes regular foot care an essential part of diabetes management for those affected by neuropathy. 7. Blurry vision. Blurry vision is more than just needing a new pair of glasses. It can be a serious warning sign of diabetes. If you've noticed things getting fuzzier, it might not be your prescription that's changed, but rather an indication that high blood glucose levels are affecting your eyes. You see, when blood sugar levels soar, they pull fluids from the lenses of your eyes, making it difficult for them to focus properly. It's like trying to look through a fogged-up window. Everything becomes distorted and unclear. While it might start as a minor inconvenience, untreated blurry vision can escalate. High glucose levels can lead to the creation of new, fragile blood vessels behind your retina while damaging existing ones, a condition known as diabetic retinopathy. This can result in leaks or even block blood supply to parts of the retina. Left unchecked, these changes can progress to partial or even complete vision loss. But here's the good news. According to the American Optometric Association, early detection through regular eye exams and diligent blood sugar management can significantly reduce the risk of severe eye complications. Catching these changes early allows for timely intervention, like laser surgery or other treatments, to preserve your vision. Understanding the link between diabetes and eye health is crucial. If you start experiencing blurry vision, don't just brush it off as a sign of aging or fatigue. Instead, it's vital to schedule an eye exam and discuss the changes with your healthcare provider. They can help determine whether your blood sugar levels are the culprit and adjust your diabetes management plan accordingly. 8. Increased appetite. Have you noticed an unusual increase in your appetite, especially when it involves sugary treats? This could be more than just a change in taste. It's a significant warning sign called polyphagia, often seen in seniors with diabetes. Polyphagia occurs when diabetes hinders the dietary glucose from entering your cells. Even after enjoying a hearty meal, you might still feel those lingering hunger pangs. It seems counterintuitive, right? You're consuming food, but your cells feel as if they're in a famine. As a result, your body signals hunger, pushing you to eat more in an attempt to gain the energy it's missing. However, this can trigger a frustrating cycle. You eat more, which then spikes your blood sugar, leading to more cravings, especially for carbohydrate-rich and sugary foods. Ignoring these hunger cues can exacerbate health issues. Frequent high blood sugar levels can lead to other complications, such as increased fatigue, fluctuations in mood, and more. The American Diabetes Association emphasizes that recognizing and managing these signals is vital for maintaining balanced health. Breaking this cycle involves understanding the relationship between your diet and your diabetes. Having a well-structured meal plan that balances carbohydrates, proteins, and fats can help maintain more consistent blood glucose levels. Adding more fiber-rich foods can make you feel full longer, reducing the urge to overeat. 9. Dry mouth. Dry mouth, or xerostomia, is more than just an annoying sensation. It's a common symptom of diabetes, particularly affecting older adults. If you've experienced that parched feeling, along with dry, cracked lips or a rough tongue, you might be dealing with more than dehydration. It could be your body signaling issues related to fluctuating blood sugar levels. With diabetes, your mouth can lose its ability to produce enough saliva, leaving you with this uncomfortable dryness. Saliva isn't just for tasting. It's crucial for washing away food particles, neutralizing acids, and keeping your mouth moist. Without sufficient saliva, your oral health might take a hit, making you more prone to cavities and gum disease. The American Dental Association emphasizes the importance of saliva for oral health, pointing out that reduced saliva can impact your ability to chew and swallow, even affecting your speech. Over time, these issues can contribute to nutrition challenges and overall discomfort. Recognizing dry mouth as a symptom tied to your blood sugar opens up avenues for management. Drinking plenty of water throughout the day can help. Chewing sugar-free gum or sucking on sugar-free candies can also stimulate saliva production. Make sure to steer clear of caffeine and alcohol, as they can exacerbate dryness. Understanding and recognizing these 10 danger signs of diabetes is crucial for maintaining your health and well-being, especially as we age. The signs may seem subtle at first, like extra thirst, fatigue, or blurry vision, but by catching them early, you can take steps to better manage the condition and prevent more serious complications down the line. Each symptom we've explored today is your body's way of communicating that something isn't quite right. With the right attention and intervention, you can address these issues head-on. Managing diabetes isn't just about medication. It's about keeping a close eye on how you feel and making informed choices about your lifestyle and health. By doing so, you're taking control, empowering yourself, and living life to its fullest potential, despite the challenges diabetes might present. If you're looking to keep your diabetes in check while enjoying delicious meals, check out our cooking channel just for you. We share tasty, diabetes-friendly recipes that make healthy eating easy and fun. Don't miss it. Head over now and start cooking with us. We will leave the channel link at the description. If these insights have helped you, or if you have your own experiences and tips to share, leave a comment below. We'd love to hear from you. Don't forget to subscribe to our channel for more health tips and in-depth guides on living well with diabetes. And make sure to check out the next video on the description. Thank you for watching and take care of yourself. Thank you for watching our video today. If you found this video helpful, please drop a like and subscribe button to support us. We truly appreciate you support, and it will motivate us to continue make more information video to help you all. Thank you and goodbye.